live.
Not yet.
Yes, we are. You're just watching a delay.
Oh,
Welcome. We're just kind of testing things out right now. We plan on actually doing a lot more things with this live stream, considering what's going on with COVID-19. Appreciate the 8 viewers we have. We haven't broadcast this out on any other networks yet. But right now we're looking at the numbers, and it's very concerning as a lot of different places are sheltering in place at the moment with lockdowns. So I'm on to world, and I am in the Midwest of the United States, and I also have another person on this live stream.
yeah. I'm Discordian. I live in Europe.
Welcome,
Good
Discordian.
evening, ABC. Thanks for watching our test stream. We plan on doing this regularly from now on,
All
but
right.
we're still testing the waters.
Well, I mean, I think we're over the testing phase. We've done this plenty of times before during presidential elections and stuff like that. But I think what the real concern is we want to give the people the actual data and the numbers of what is actually going on without any form of propaganda or conspiracy behind it.
Yeah,
So,
exactly.
and ABC 123 XOXO. Good evening. Germany's far from me, but not too far from my friend.
No, we're neighbors. I'm close.
Dankeschön.
Can you sort the numbers the way I told you to?
Yes, I will throw the numbers on. Just 1 second. I am sorting through a whole bunch of stuff right now, so give me a second. Too many things open. I apologize. All right, so sorting the numbers, and right now we're looking at Italy that has the largest death toll in the world happening right in front of our eyes, and it's
Bigger than China.
it's very intense. It's insane. So
Yeah.
the new deaths just today is 627 people.
In Italy, and in Spain it was 221 today. Iran reports another 150 deaths, though we don't know for sure that's accurate because they're really struggling with the situation. We've seen mass graves from satellite imagery. Now, I don't want to get into conspiracy theories, so we have to go off of the data that they are providing us. But they also released 85,000 prisoners.
Yeah. And the U.S. is thinking about doing the same thing with that kind of for nonviolent offenders. But if we're looking at the numbers statistically here, and you're looking at the case fatality rate in Italy alone, okay, you're talking 8.5% case fatality rate. That's horrible.
Yeah, by comparison, the seasonal flu has a case fatality rate of 0.06%. And let's just take a sample size of 400 million. Let's say 400 million people get this virus, and only 1% of those people die. You're looking at what? 4 million deaths?
Well, you said what, 400,000?
400 million.
Oh, four
Let's
hundred
say
million.
400 million people
Right,
get it. The case fatality rate is 1%. That means 99% recovers. Then we're already looking at like 4 million deaths.
right. So, I mean,
Uh,
I switched over to a map which shows the ballooning of this virus going on through the world. And it looks almost like, a nuclear attack scenario here where all these red blotches are all over the place. Europe is just inundated. It's insane. It's everywhere. And it's such a small, compact place. I mean, the United States is more, spread
more widespread.
out.
Yeah.
Yeah. But in Europe, it's just so compact that it's overlapping. And when we look at China now, it's not as bad at all.
No, it's way worse in Europe than it was in China. But China took pretty drastic measures.
They did, and I'm not one for communism or draconian measures at all. But unfortunately, if people don't want their countries overrun, their healthcare systems overrun, I think that's exactly what needs to be done.
Yeah, but China went pretty far in their measures. I mean, they welded people shut. They had like troops of people in hazmat suits disinfecting the cities.
I think there should be troops of people in hazmat suits disinfecting the cities, but I don't think that we should be having our doors welded shut. It's a little ridiculous.
It's also a little ridiculous to laugh at it, of course, but
It is because it's so far from what we're used to. It's
Mhm.
like mind blowing. So, I mean, out of nervousness, you laugh about it because you're confused as to why some people take such actions if they didn't trust their citizens so much. You
Now I
know,
wonder what's going on in Belgium.
why do you say that?
Well, they've seen a massive increase in deaths today compared to the amount of deaths they had.
Right.
Same counts for Germany, of course. But Germany has been testing like crazy. I mean, look at the amount of cases they have.
No, you're right. I mean, I can't disagree with anything you're saying at all.
When you compare that to Spain, they almost have the same amount of cases, but Spain has like a tenfold in their amount amount of deaths. No more
Right.
than tenfold.
Right. No, I agree. Um, so this is just kind of a test stream. We're going over data. There have been some admins on the account on YourAnonNews reporting on this daily, because from the beginning we knew there was going to be an issue, and I do commend Disco on all of his hard work that he's put into this.
Oh yeah, I've been chasing the virus since day one, when there were reports of a small cluster of pneumonia patients in Wuhan, China, and then there was this doctor that says, "Yeah, this looks like SARS. It's a coronavirus," and then he got arrested for saying that,
And then he died.
and he died of the virus he discovered. Yeah,
But he was also a 30, how old was he? 36, 34,
39, I believe.
39. I don't know. How old was the doctor in China? Let's see.
Uh, there was also a 29-year-old doctor that died in China.
I don't know. I'm finding out. He was looking
He was
here.
30.
I could have swore he was like 34. I don't know. I can't find it now. 34. Aha. Dr. Li
Li Wenliang.
Wenliang, who died at the age of 34, became one of the crisis' most visible doctors, blah, 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 because he discovered it. So, yeah, what we're going to try to do on these lockdown, quarantine live streams, since a lot of people are no longer working on the planet Earth, we're going to try to bring you the latest numbers and try not to scare the hell out of you at the same time. I mean, it's a scary
I
time,
think
and
people.
people need to not panic, really.
Well, there needs to be some sense of caution, because if you think you're invulnerable to this, then you're not helping in slowing down the virus. For example, those people in Miami who were having spring break. I don't know if you have that video at hand.
I don't have it on hand, but I know what you're talking about. I could pull it up. Hold on.
See, this is why we need planning.
Exactly. I mean, well, I mean, I don't know. Stop. Spring break. Here we go. But I mean, I also don't want to. I also.
It's a dream destination for
It's a dream destination.
one of Florida's largest employers. Now the streets, rides, and car parks of Disney World in Orlando are deserted.
The problem with this all is these people are putting more and more people at risk by doing this.
Yeah, because if you don't stay at home,
All right, this idiot says something. That kid with the hat, he said something. Oh, it's spring break and whatever, So
I ain't afraid of corona.
There's more serious things out there like hunger and poverty. And we need
there's more serious things out there than hunger and hunger and poverty, is what this guy just said. So
rather than go to the bars or the beach, and they're closing all of it. It's really messed
Yeah,
up.
but if you
way
get
more
infected, you're indirectly affecting other people. Like the death rate for people over 70 is like 20% or something.
Right.
There's a lot more people die from the flu and a lot more people
Okay,
die from swine
here it
flu
is.
and coronavirus.
This is the dumbest thing that anyone could ever say. All right, so listen to this dude, what he's saying here.
Swine flu.
All right, let me back it up just a little bit more. There's a lot more people that die from.
There's a lot more people die from the flu and a lot more people die from swine flu than any coronavirus probably will ever kill.
Okay, so obviously this mental giant has never done the calculations that me and Disco have. And you know what? It's simple math.
You can do it on the back of an envelope.
Okay, so it gets into percentages, and it also gets into R naught factors. So me and Disco kind of argue about the R naught of this a little bit back and forth because I'm
I think it's
convinced.
2.5.
Oh, so you upped it?
No, I didn't up it, but go on.
All right.
You
See,
think it's 4? That's insane.
I think it's 4.
And that's based off of data from the Californian government, I believe.
It's based off of worldwide data where you're seeing mass community spread, especially in Italy. Okay, so you take those small numbers, and yes, I can base that off of the California math model too, because when you're looking at the 25 million people, and they're saying that 50% will be infected by blah 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 within 8 weeks, that's an R4. That's not R2.
Okay, so let me explain what an R naught is. For example, if you
Oh
have
yeah,
an
explain that to the audience. I'm sorry.
For example, if you have an R naught of 2, you will see exponential growth of the virus. So one person infects 2 people, those 2 people infect 4 people, those 4 people infect 8 people. So 50,000 people will infect 100,000, 500,000 will infect a million, etc. So that's where you get the situation where hospitals are like, well, this is no big deal at first because they only have like 100 cases, but those 100 cases become 200 cases, and then all of a sudden they're up to 1,000, and they're saying, oh, this spread so fast, we didn't see it coming.
Exactly.
Yeah, no shit. It's exponential growth.
So with an R naught of 4, you're talking one person is infecting 4 other people. So if I go on a bus and I sit down next to 4 people and I'm breathing on them, I'm like, hey, what's up? They're going to be like, oh, hey, nothing, what, can you leave me alone? And then they're going to go home to their families. And since it's an R naught of 4, they're going to spread it to their family too. So The growth is the exponential growth in this is insane, and that's why there's no way this is an R naught of 2, in my opinion.
Yeah, but an R naught of 4 would infect like the entire world population within months.
Well, I mean, look at how quickly it has infected so many people with these measures taken.
Yeah, that's true. That kind of skews things, of course, because China welded its people shut in their homes, and Italy is on complete lockdown.
Yep. US is not in complete lockdown, only certain states are. The state that I am in is under a shelter in place order. So, little scary, but you know what? Here's the thing is if it didn't happen, then more people will die.
Yeah, that's true.
So,
And also, there's this myth that it only affects old people.
not true.
In the Netherlands, there is a 16-year-old that is in the intensive care.
There's a 3-year-old in the intensive care in my state well, I'm from Illinois, so yeah. So there's a 9-year-old that's affected by this in my state. It affects kids. It is not just for elderly adults from 40 and up, or even the factor of, yes, okay, it will probably affect elderly people differently because their
And
immune system,
predominantly, yeah.
yeah, because their immune system is, not as great as a younger person's is, but younger people can get it too, and
And can get quite severe disease from it.
right, and which will affect them the rest of their life.
Was it the study in Hong Kong that said COVID-19 had permanent lung damage?
Yeah, scarring, yes.
Yeah.
Yeah, so there's a lot of information that I don't think the general public really knows about, such as the how long it can stay in the air for, um, transmission rates, stuff like that, like and also how the factors of weather. This isn't going away in the summer. This thing can survive at 97 degrees Fahrenheit, which I think is 34 Celsius.
Is that the Thailand cluster or the Australia cluster?
This was the Chinese cluster that was experimented on by Chinese scientists, and it could live for three to 4 days in that temperature.
No, but I mean, there are also countries where it's quite hot, where it's spreading.
Yes, that's why when they did the tests in China, it showed that um, it's aerosol. So when I'm talking, it's in the air, and it stays in the air in an enclosed environment. Let's say like in my house, or I'm on a bus or in a car. It stays in that environment for a
Or on a
half an
cruise.
hour. For a half an hour. So I'm sorry. What'd you say, Disco?
Or in a cruise ship.
Yeah, in a cruise ship, and then oh, they were in a, yeah, they were in a petri dish. What were they
Yeah.
thinking?
Well, they didn't really know during the Diamond Princess, but the cruises thereafter are entirely the fault of the people who went in it, in my opinion.
Yeah, I mean, it was. I think they did it on purpose to experiment with them. Just
With the Diamond Princess.
yeah, it was a scientific experiment to see. Okay, let's see what happens if we do quarantine all these people together. And duh, hello, it's getting everywhere.
It also went from room to room, I believe, through the air vents, maybe?
I can't necessarily say that is 100% fact, but what I can say is that the cruise ship members who were feeding them food and giving them drinks were not in 100% hazmat gear, so they were probably able to transmit it easier than it would be going through an air duct.
And wasn't the quarantine officer of Japan?
He was kicked off the cruise ship because he was calling them out on their BS.
Yeah.
So yeah, this is some serious stuff, and that's why I think if you can shelter in place, and me or Disco aren't all pro government, but we do realize when there's a need for common sense here.
Yeah. Exactly. I mean, with the flu, you don't shut countries down entirely, risking the collapse of your entire economy. This is worse than the flu. The government knows it.
Well, yeah,
People
because
do not
they
realize it yet because they cannot comprehend exponential spread.
because they can't see it. So that's what's confusing psychologically to a lot of people. This is something you can't see. It's not in front of their face. They're not seeing people coughing and, you know, you know, I can't breathe, in front of their faces yet. Will they? Probably, if they, continue to not quarantine themselves or remain in place. So I mean, this has the potential to really get out of control, and I think that's what a lot of people are afraid of.
Yeah. Also, a lot of people say, well, 80% of people recover. And that's that's quite scary to hear for me, because when people say, "Oh well, 80% recover," to me that sounds like, "Oh well, 20% die." Now, this very virus doesn't kill 20% of the people who get it, but
No,
inadvertently, that's what you're saying when you say, "Oh well, 80% recovers."
right. Well, okay, so here's the thing with that. So 80% recover, and let's say 80% of the population gets it, and 80% of those people recover. 20% of those people don't recover and go into critical condition and that they need ICU, and 6% of those people don't make it. That's a lot of dead people depending on where you live.
Oh yeah, that's true. Like in the Vatican, it won't be. But in a place like the United States, we're looking at potentially hundreds of thousands to millions.
Well, that's the problem is this is a densely populated country with 330 million people living here, and if you have 6% of the population dying from
Oh yeah, there
this,
will be millions.
yeah,
But I'm not saying it's 60% because there's this lack of testing.
well, that's another thing is the government here dropped the ball on that. While they could have been putting a stop to it, they were calling it a hoax.
Yeah, if you don't test, you're fighting the virus blind. You can't see where it goes, and it will pop up everywhere. And you'll be like, hey, where did this come from?
There's no scientific analysis to it either. So you're not testing people. And I've
No.
had people tell me testing, is stupid. Why don't you just treat the people? So you're not tracking this virus that it will potentially pop back up in your community.
And you also need the data so that other hospitals know what to expect.
And
Uh,
without that data though, it's just going to pop back up.
yeah, and without that data, the case fatality rate will be very high because you need to know how many cases there are.
And you
And
also need to know if it's just the common flu or if it's the coronavirus. So, I mean, there's a difference.
yeah, there's a huge difference. For
So,
H1N1, for example, we probably all have immunity, at least the people who got vaccinated.
right. No,
Are
I
you ready?
agree. I mean, yeah, right. Yeah, you're lying. No, just kidding. But we'll try to bring some lulls into all this too. Share some memes with you. This can't all be doom and gloom because there is a bright side to this. Look, you get to spend time with your families. You get to spend time with yourself and analyze, who you are as a person too. It's more than just, oh my God, I got to stay home from work from the virus. You get time off now. Most of us. I mean, some of us can work from home, but you know what? Working from home is so easy to do these days, and you could just step right into the kitchen and get a cup of coffee and do whatever you want. You're more free now.
You can also play video games all day if you don't have work.
Exactly. I mean, this is the time of reflection for people, and if people are dismissing that, they need to really reevaluate what they're about. Are they for constantly working for the system, or are they for, being geared towards compassion and humanity? It really should be towards compassion and getting us out of this by understanding what needs to be done.
Mm-hmm. So, what do you think about the UK response to the coronavirus?
I think they're late. I think they should have made. I mean, they're just acting like the United States in this instance. I mean, okay, they're going to be paying people money, just like the United States is going to be paying
Okay, and
people money.
explain that to our listeners, to our 6 people listening. At
we could shoot it up, but then when we get a whole bunch of listeners, then they're going to be like, "What are they
fucking
talking about?"
yeah.
So the United States is giving packages to its citizens that are impacted by the virus. So, like me, I should be getting, I don't know, maybe $2,600 or up to $3,000. I'm not sure. But the UK is doing the same thing for its citizens who are impacted by the virus too, because in these
This
countries,
is an unlimited fund, right?
I'm sorry.
This is an unlimited fund, right?
Well, here's the thing. I mean, we could get into the insane politics behind this, where they're screaming and yelling that universal basic income will never work, Medicare for all will never work. But look at how much money is being thrown around right now.
Mm.
So it kind of dismisses those arguments,
How much
and
was pumped into the stock markets in the USA?
I think it was 3.4 trillion now.
That's insane.
For a half an hour of relief, so the market wouldn't crash for a half an hour.
You can easily pay every citizen with that money.
That's $10,000 per citizen. Adult citizen, I should say.
Crazy.
So I mean, this is the scope of how capitalism is working, where they are coming up with these crazy amounts of money that are appearing out of absolutely nowhere.
Oh, by the way, ABC 123. Yeah, Germany was very late with their response, but they have been testing a lot of people. They have been ahead of the curve for a very long time, but it seems like they failed in isolating its people. Because can you go back to the updates?
Yeah. Where are you looking at? Yeah, I'm on the updates right now. They're on. It just probably is a lag in the stream, so
Yeah.
it'll appear in a second.
So if you look at Germany, you see they have 19,848 cases. That means they've been testing a lot. But you also see their death toll spiking at the moment. 23 deaths today already, you know? So they didn't contain it. They did test, but they didn't contain it.
That's the major problem is, okay, this is an asymptomatic disease. So you can be walking around and not feel any of the symptoms, but you're transmitting it. Okay, just by speaking to people. And this is what a lot of people can't understand. Usually they think people are transmitting it by sneezing or coughing. No, not in this case. In this case, it's transmitted before the sneeze and the cough. And then later on, 2 weeks later, when you start getting symptoms, then you start transmitting it even more when you're sneezing and coughing. So you're transmitting it throughout this entire time. And I think they were saying the last 7 days or whatever is when you actually stop transmitting it, if you survive it.
Well, that's not a big if.
Yeah, I mean it's not. It's a 6% if. It's an 8% if in
Italy.
Italy.
I still think it's more widespread in Italy than what they're saying. That's just because of the lack of testing. I'm thinking you have a 1% chance of dying, and that is still a huge number because that means 1 out of 100 people.
That's a low ball number, dude. That's really low ball.
Yeah, but we have to be realistic here.
We are being realistic, but if you look at the world numbers, the case fatality rate in the United States I calculated earlier today was at 1.5%. Okay, but
Yeah.
in like places like
And it will
Italy,
go up
oh, it's going up. Yeah, absolutely.
because in South Korea it was 0.04% for a very long time, and now it's like at 1.2%, I believe.
Yes. Yeah. So we're gonna get into all this stuff probably more tomorrow. I mean, we're gonna have a lot to say on this. We'll even bring up some of these crazy conspiracy idiots that are talking, and we'll bring up some of these people like this guy, John Jordan, tourist, who doesn't understand the implications of what he's saying because he has a young child right here next to him. Okay, and the problem is when you're this lax on your own health and you don't care about how you're affecting other people, especially if you might be a carrier of this disease, you're gonna kill a lot of people. And
Especially elderly. Like you might kill your parents or your grandparents,
right,
and
and
that's I'm not saying that lightly.
no, not at all. I mean, and it shouldn't be taken lightly. Like I haven't seen my parents in over a week or two now. When this all started coming out. But you know what? Me and you have been screaming from the rooftops from the beginning before any government was about this stuff. Even
Yeah,
China was trying to cover this stuff up, and me and you were like, no, man, this is bigger than that. And sure enough, every single thing that you have said and that I have said has come to fruition. And, people need to
because they're easy back of the envelope calculations.
exactly. And it's simple to do. It's just like, okay, so here, I'll show you real quick. So let me get back to here. So let's do the case fatality rate here. Can you punch up the numbers while I read it off, Disco?
Yeah, sure.
Okay, so we have a total of 19,848 cases in Germany right now. The total death in Germany is 67. So what is the percentage of 67 out of 19,848?
0.3%.
So that's the case fatality rate of Germany right now. So see how simple this is? And then you could even, run the R naught factors, the RO factors of this stuff and see, using mathematical calculations that's supplied for you on the World Health Organization's website.
And for example, look at the global total that's at the top of the website. Can you cite those numbers for me?
The global total right now is 272,820.
And how many of those are dead?
11,313.
That's a lot of people. Divided by... That's a 4.1% case fatality rate worldwide.
That's
that's
insane.
And that's not factoring in the people who are in critical condition at the moment. Lots of countries don't report how many people are in critical condition.
Right.
Like Germany says they only have 2, but they have tens, if not 20s, of deaths per day.
Right. And if you guys want to, keep this is pretty real time when these people report on this and the numbers come in. You go to worldometers.info/coronavirus. and it has all the information per country.
Yeah. So, and you see that Italy and Spain accurately report how many people they have in intensive care, but Iran doesn't. I mean, they're a pretty poor country as well. Not to shame them in any sense. They can't.
Well, I'm going to stick up for Iran for the simple fact that, it doesn't help that they've been sanctioned all to hell. And it reflects on, what's going on with how many people are getting it, how many people are dying.
That's where I was getting at.
Yeah. Sorry. Didn't mean to steal your thunder.
No, it's all right. You worded it perfectly. And you also see that the numbers in France are very much worrying. That 78 number is going to go up exponentially,
Absolutely.
like it did in Italy.
And we're not scientists here, I mean, we're, we're into the hacktivist culture, but I think we see things in a different light than a lot of different people because we think outside of the box. And I'm not patting ourselves on the back; it's sometimes a curse. But when you look at this stuff, we see the numbers, and I don't want to really get into it, but when President Trump in the United States looks at these numbers, he just shrugs his shoulders and like, okay, whatever.
Well, he did at first, but then he got informed by the experts, and then he was like, "Holy shit, we're in this for the long haul."
Well, yeah, well, he still, I don't think, really understands the implications of all this. If he did, he would.
Sure, I'm not sure. His shift in tone was pretty drastic.
He did have a shift in tone. I'll give you that. So, I don't know. We'll see what happens, dude. I mean, he's driving the car, and it's a wild ride.
Oh yeah, it definitely is a wild ride.
I mean, I feel bad for all you Europeans that now have to deal with this insane, I don't know. I don't even know what to call it. I don't even want to call them the government because it's just I don't know who they don't represent us. I mean, they represent a portion of the United States, but not us, like the real people. Everybody else is fake. They're all fake clones, bro.
The person who understood it from the beginning, but was very irresponsible at first, was Boris Johnson. He was like, yeah, lots of people are going to die, but we can't shut down our economy.
But that wasn't even said in the beginning of it. That was said like literally a couple days ago.
Yeah, I'm trying to find the link. We tweeted a lot for the past few days about this.
So on the Twitter account, YourAnonNews, we know that some contributors aren't happy with us constantly inundating the public with all this stuff, but we think
Seriously?
it's important.
I haven't heard anyone cry about it.
There was one cry about it, and we could get into that off the air, but it's not a big deal. They understand why, but they just think it's flooding the timeline, and it's not a big deal. It wasn't anything like, what the hell are you guys doing? No, it was more like, the timeline's getting flooded with all this. And I'm like, well, yeah, because it's important information. And then nothing else.
Where can I send you a link off screen?
You can DM me. Or through the program we're using. All right.
You can show that to people with the sound on.
Yeah, just a minute. Okay, so let's go here. All right, wait.
I've got to be clear, we've all got to be clear, this is the worst public health crisis for a generation. Some people compare it to seasonal flu. Alas, that is not right. Owing to the lack of immunity, this disease is more dangerous and it's going to spread further. And I must level with you, level with the British public. More families, many more families are going to lose loved ones before their time. I've got to be clear, we've all got to be clear, this is the worst.
He almost talks about it like it's an inevitability, you know?
Right.
Like he can't do anything about it. Like, yeah, it's there.
Because he has scientists telling him what we've been telling people.
Yeah. But I still think you can stop it. The WHO still believes you can stop it.
Absolutely. I mean, the problem is you have numbskulls like that one guy, who are in every country talking like it's the flu, like it's nothing worse than the flu. So you have this guy right here.
And a lot more people die from swine flu than any coronavirus probably will ever kill. Everybody's going to get it eventually. It's a viral infection.
Everybody's going to get it eventually. It's a viral infection. Okay, so true. I think probably whose estimates are low that 70% of the population of the earth will get this.
That's a lot of people, though.
I think it's low. You see the transmit? I mean, unless there is an immediate vaccination for this thing, or they come up with an antiviral for this thing immediately, you're going to see exponential growth like you've never seen before, dude.
Yeah, that's true. It really goes that fast. You can see that in the chart in the charts.
Dude, look at check out the numbers. You have over a quarter of a million people who have it within how many months? 3 months, 2 months, 3 months?
And it's growing exponentially. So now it will take less time to get it to 500,000, and it will even take it will take even less time to get it to 1 million, and it will even take less time to get it.
Yeah, exactly. So we're talking here. I'm going to punch up some numbers really quick in my calculator here. 272, 820 times.
What's the doubling time?
I'm going to say
every 3 days.
I'm going to say 4 months calculation here is 1,091,280.
Earlier than that. What is the doubling time?
The doubling time?
Yeah. See, we should have this information.
I know, we should. I'm drawing a blank because we had this information the other day, and I don't know. It's every... Doesn't WHO have that information? Public advice, situational updates, blah, blah, blah. Technical guidance and global research. No.
It doubled in 2 weeks.
Okay, so 2 weeks. So in 2 weeks, you're looking at times 2. So let me go back to our thing here. 2 weeks, we're talking. All right.
I think the doubling time is a little lower than that, because in Italy it's like 4.1 days.
I don't think so, dude. Here. So in 2 weeks, you're looking at numbers of 500,000 people having it. 545,000. 545,000.
So in a month, it will be at 1 million.
Yeah. I mean, dude,
it might be a little bit earlier than that. But
it's going. I mean, you could see it with look at the charts here with total deaths on a linear scale and total cases on a linear scale. You could see March 18th. Okay, March 16th. Hold on. So it was at 200K on the 17th, which was 3 days ago.
Mm-hmm.
It's 244,933. Oh, it went up already. So, yeah.
March 17th, it was 200,000. And it went to 250,000 on March 19th.
Yeah, 244,933. 244,933.
That's 50,000 in 2 days.
Pretty much. 46,000 in 2 days. Yeah. So
Crazy.
it's you could easily reach those numbers.
Yeah. It doesn't have a sense of slowing down because the curve first need to level off, and
And
then
that's all
it needs to go down.
and that's the point of isolating you and your family from everybody else. Social distancing. And it's not socialist to be social distancing because you're not socializing.
What the fuck?
Except on social media. So then you're a socialist.
Mm-hmm. Who said that? Wasn't it Mike Bloomberg who said, "Oh yeah, young people like socialism because they associate it with social media."
Exactly. And it's just like, get out of here, you clown.
Netherlands not looking too good either.
Well, they need to up their game over there because I don't know what the problem is with. I mean, why is everybody following the United States example in this? I don't get it. It's just like, no,
Well, the USA significantly ramped up testing.
they have, but guess what? Okay, so
It
here's
was too late.
it was too late because there was already community spread, and that's why like people are like, well, why even test anymore? Well, because of scientific verification. But the story behind the USA is this. So who was going to give us hundreds of thousands of these kits, these test kits to
And
test?
America said, "Nope, we don't want them. We'll make them ourselves. Made in the USA."
And guess what happened to those first kits that they made?
They were faulty.
And so they were sending people who were infected with the coronavirus back out into the public.
And they spread it.
And now we have what we have.
And it's going to get worse. The government in the Netherlands is saying that the peak will be in a week. And I don't know where they get those numbers from.
There's no way in hell. I'm calculating it out to be June, where peak is.
Based on what?
Look at the numbers. So, no, seriously, on WHO's website, if you downloaded the WHO report, it shows peak hitting in June.
Yeah, but that's the worldwide peak. It means it will spread to other countries as well, and they will have their
Well, I
peaks.
mean, that's what we're talking about. I thought that's exactly what we were talking about was the peak.
No, the Netherlands is saying that they will have their nationwide peak in a week.
Italy hasn't even reached peak, and look at how many people are being infected per day.
And how many people die per day.
Right, that's almost 6,000 people in one day, and you're talking 627 deaths in one day. That's insane. That's an insane amount of people. And it's going to just get worse because they don't have the beds to house these people or take care of them.
When you look at how many people are in critical condition. Because I read the reports from the Italian health ministry.
Right.
And the serious critical column shows the exact true number of people who are in the intensive care in Italy. For some countries, it only shows hospitalized, and for some countries, it doesn't show anything at all. I'm not sure what the definition for serious critical is, but I do know what it is in Italy.
Serious critical would probably be people who need in intensive care who need artificial breathing, sure. Who can't breathe on their own readily without an oxygenation.
Like Darth Vader.
Yes. So the scary thing here is the total cases is 47,021, and the recovered cases is only 5,129.
I don't want to
That
be a conspiracy theorist, but compare that to China.
well, I mean, let's look at China. Holy crap, where are they? They're all the way down here now.
Click on total cases.
No, okay, yeah, all right, we'll bring them up to the top. Oh, darn it. Okay, so 80,967. Okay, and they had 39 new cases today and 3 deaths today. But the total deaths versus, and total recovered. Okay, so you're 9,000 off of a total recovery. 10,000 off of a total of all these people being total recovered. 80,000. So 80,967 cases, total recovered 71,150.
That's not what I'm trying to say, though. Italy only has about 50,000 cases and already has more deaths than China.
Right. Because they didn't take the draconian measures China probably had to take. Unless
They did take pretty draconian measures.
unless China's lying, which they could be.
I'm not sure, though.
But look at the numbers, dude. I mean, check it out. Italy, 47,000. And then you have 3,248 deaths in China versus 4,032 deaths. And it's almost...
It doesn't compare.
It doesn't. And then Italy's supposed to have top tier healthcare.
Italy has top tier healthcare. They're on I believe they're first in the world of healthcare ranking.
No, but okay, so yeah, they're first in the world. So
I'm sorry, I was laughing because of a sound you made.
Oh. Anyways, dude. Yeah, it doesn't make sense. They have better healthcare than the United States. So what changed here? What changed in China?
I really do think it's the insane measures they took, or they're lying because it doesn't correspond with the phone calls from the crematorium workers.
It totally doesn't. And there were people, who were doctors who were freaking out.
Yeah.
Live streaming. We can't handle this anymore,
And they built entire hospitals specifically for COVID-19.
And I think one collapsed.
No.
I heard one collapsed.
No, that was a hotel that collapsed.
That they were using as a hospital.
Yeah.
All right.
No, they used it as a quarantine facility, not as a hospital. Right. Those were suspected cases, not confirmed cases. Makes you wonder, though.
Let's see the rest of this Al Jazeera garbage. I mean, these people in Florida need to get a life.
Miami Beach are now closed, but stiffer measures may be needed.
No,
it's
they
hard
need to
to believe
stop
this
having
far
a life.
into the crisis, there are some that appear unconcerned with the pandemic. While the young are less at risk, they're not exempt. They may not get critically ill, but they could also be carriers for the more vulnerable.
And that's the point we were just making, is these people could be carriers for the more vulnerable and infect them. So yeah, needs to stop. These people need to stop being so stupid and just being selfish and thinking about themselves while they're going to be affecting other people.
Yeah.
Anyways.
Totally agree. I think that's a good bombshell to end the stream.
I do too. And I think everybody who has been watching, I haven't really been looking at the chat or anything, and I apologize. When we do the actual major live stream about this, we will be interacting more with the people chatting. So we thank everybody that came
We're
out
part of this trial. Yeah.
and this is kind of a trial run, and we'll have more advanced stuff going on tomorrow. And I want everybody to stay safe out there, and just remember, keep your mental faculties sharp. Well, don't subscribe to these idiots, though. I mean, it's just the flu. It's not.
No, it's not.
So
No, but that guy from Germany was joking about it being the flu.
Oh no, I haven't been I don't know what they're saying because I'm not like watching the stream because I'm streaming it. You know what I'm saying?
All right.
All right.
Thank you for being part of this trial.
You're
I've
welcome.
enjoyed it.
Thank you. All right, so we're gonna go to the outro now, and I don't know. Take it easy, everybody. Bye. Peace.